doctor.
Hysterectomies are more common than we imagine. It's estimated that between 20 to 35% of all women will have a hysterectomy before reaching the age of 60.
There are many reasons for a woman needing a hysterectomy. The most common reason is for heavy bleeding, but there are other reasons as well. Fibroids, which are benign growths in the uterus, they themselves are responsible for causing heavy bleeding in many cases, and they can become very large. A relatively new development in the treatment of heavy periods has been the development of an intrauterine system or device called the Mirena. Mirena device is like a normal contraceptive intrauterine device, but the shaft of the Mirena gives off progesterone continuously over a period of 5 years. Now, this is a model of a woman's uterus and ovaries and tubes, and this is what the Mirena looks like. It's a tiny little device which sits in the womb, and the shaft gives off progesterone, which thins this lining over here to the point where there's just about no lining left. And this has been a great innovation and saved many, many women from losing their uteruses.
Many women fear losing more than just their uterus. Anxiety around the effects of surgery on their sexual functioning and psychological well-being is top of the list.
One's attitude is really important beforehand because that will determine the outcome. If you look at it not as the victim, but look at it in terms of, I need to have this, I'm still okay, I'm going to be healthy afterwards. Look at that attitude, because when a person is stressed, they do not heal as quickly. The potential hurdles are anxiety, possible depression, as well as a lot of women they're feeling the loss because it is the uterus that has been removed. It's like a grieving process. But for some women, it's great. You know, they've had their children and they don't really mind. So look at it carefully, and depending how good your coping techniques are before the operation will also impact afterwards how you cope with it.
With a number of alternative treatments, a hysterectomy needn't be the only option, though many women who have had their uterus removed experience significant benefits.
Well, I needed a hysterectomy after 8 months of backwards and forwards with the doctor. I had fibroids, which once they cut me open, they discovered there were 2 of them the size of grapefruits, and they were not going away on their own, and they were growing. I didn't want to have it because I really didn't want to go through surgery and the recovery period. I realized that I had to come to the acceptance myself, and I appreciated my doctor allowing me that time. You know, everybody's different. If I was 21 and told that I had to have a hysterectomy, it would be an emotional disaster. But at the age of almost 50, it was completely different. My mother also told me that she danced down the corridors after her hysterectomy because it solved so many problems. And I kind of looked at it from that point of view. She was younger than me when she had it, but now that it's over, I mean, it's a year and 2 months later, and I'm absolutely fine. I'm fitter than I've ever been, and I'm in a pretty good headspace about it.
If a woman is struggling after the hysterectomy, please, she mustn't leave it and think it's going to go away. If it's impacting on her life, that she's thinking about it almost every single day, and she's not having proper sexual functioning, and it's impacting on her relationships and her family, please, there are support groups that she can have a look at. She must look at books. She must look at her whole attitude. Be empowered by getting all the information, so when you speak to your doctor, you know what kind of questions to ask.
The general feedback is very positive. Very positive indeed, especially for women who've had hysterectomies for bleeding problems. You know, suddenly for the first time, they're not bleeding anymore. And the general comment I get is, I wish I'd done this many, many years ago.
Hello, doctor.